Hi, Cindy.
Hi, Victoria. How are you?
How are you?
I'm fine, thanks.
All right, let's give it a few more minutes as we wait for people to come in, if that's okay with you.
Sure.
For those that are logging on, we're just giving it a few more minutes for some more participants to join. We'll get started at 5:05. Okie dokie, let's go ahead and get started. First of all, I wanted to say hi and welcome to everyone on the call today. This is our first session of the Maison Blue Covered Learning Series, and we're really excited. My name is Victoria Worthington. My pronouns are she, her, and hers. I work as an intern at the Maison Blue Cupboard, and I'm honored to be hosting this learning series. Today, we are joined by Dr. Cindy Leung, Assistant Professor of Nutritional Sciences, and she is going to discuss the topic of food insecurity and access. After Dr. Leung's presentation, we'll have some time for Q&A, so be sure to use the chat feature for your questions at that time, and I will now turn it over to Dr. Leung for her presentation.
Great, thank you, Victoria. Thank you so much for that introduction, and hello to everyone here on the call. I wish we were in better circumstances and I could see you all in person, but I'm happy that with this format, we can hopefully have a slightly larger audience. Let me go ahead and share my screen and make sure all of that is set up. Okay. Oops. Sorry about that. Let's try that again. Okay. Victoria, can you tell me if you see my slides in full screen or presenter mode?
They are in presenter mode, so I don't see them at full screen. There
How's
we go.
that?
Yes, better.
Thank you. Okay. You would think after so many Zoom meetings, I would have this figured out by now. Anyways, hello again. I'm really happy to have this opportunity to talk with you about such an important issue on our campus. My talk is called No Food for Thought, and really I'm going to explore issues around food insecurity and access at the University of Michigan. This is a topic that I care very deeply about. I have been studying for a long time, and I'm trying to bring more awareness so that students who are experiencing food insecurity can access help, and those of us in positions who can do something about it can actually make actionable change. So with that, I will get started. I have a few guiding questions from my talk today. The first is just an overarching view of what is food insecurity and why is it such an important issue. Next, moving on to what do we know about food insecurity among college students broadly. Then what's happening here on our campus. And then moving into solutions. How do we alleviate food insecurity? So, starting off, what is food insecurity and why is it important? I'm going to give you the formal definition, but before I do that, I want to tell you about why this is something I care about. I am from the San Francisco Bay Area in California, and I graduated with my master's in public health from UC Berkeley in public health nutrition. And after I got this degree, I was really excited to go out and design nutrition programs and help people eat high quality diets so that they can prevent chronic disease. And my first job was working at the Alameda County Community Food Bank, which, if you're familiar with the San Francisco Bay Area, serves the entire region covering Berkeley, Oakland, down to Fremont, and as far east as Livermore. And at the time, we served 40,000 people a week. That was more than 10 years ago, and that need has continued to skyrocket. One of the first things that director of the food bank said to me when I worked there was she imagined a day where we would all be out of work, meaning we have solved hunger. And food banks across the country, especially in the last year and a half, have seen their demand increase because of the pandemic. But even before that, it has continued to rise as more and more people needed food assistance and were facing food-related hardship. At this job, I coordinated our food pantries and food distribution programs. So we had over 200 member agencies in the county, places like churches, soup kitchens, schools that delivered food to the community. People did not come to our food bank to get food directly. We distributed it to other organizations that then could give it out to individuals and families. At the same time, I advocated for SNAP and WIC. I led nutrition education demos, and I interacted with anti-hunger advocates across the state. I became really passionate about this issue that there were millions of people in my neighborhoods, in my communities, in my state that did not have enough money to afford healthy food. And realizing that food banks were part of this Band-Aid temporary emergency food assistance network. They were not meant to be the only solution to food insecurity. And so because of that, I tried to focus my entire research program about understanding the impacts of food insecurity on health, and then using that to develop appropriate interventions to better address food insecurity from the structural or systemic contributors. So after I worked at the food bank, I went to Harvard, where I did my doctoral studies, and I was learning about all of this incredible research on how on how diet patterns can prevent chronic disease like cardiovascular disease and diabetes, are leading causes of morbidity and mortality. And at the same time, I kept thinking about, well, what if people can't access those diets? What if they can't eat a Mediterranean diet because they don't have fresh fish in their neighborhood, or olive oil is just too expensive? Or, you know, their food environment is swamped with the unhealthy kinds of restaurants or kinds of foods that we don't want people to be eating because they have no nutritional benefits, or they just don't have good access to cooking facilities, or they were never taught nutrition education in school. So all of these barriers that exist for people that I served when I worked at the food bank, I was thinking about that when hearing about all of these influential nutritional epi-studies that inform us about how diet can promote health long-term. So that brings me to the formal definition of food insecurity. This is from the USDA, and it's a mouthful, but we'll unpack it together. Food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So there's a lot in this definition, but one is that food insecurity exists because the foods that we need are not available or accessible in our neighborhoods. So the places that we go to procure food does not have the food that we need. That foods need to be nutritionally adequate and safe. So if our food environment is saturated with fast food restaurants or sugar-sweetened beverages, those are not nutritionally adequate. Those are not safe foods that promote our growth and development and promote good health throughout the life course. And then finally is accessing food in socially acceptable ways, so that we expect people to be able to procure food through socially acceptable means, like going to a restaurant, going to a grocery store, not stealing, not begging for food. And some people would even argue that using a food pantry is not socially acceptable. The national prevalence of food insecurity is about 10.5%. So the most recent statistics just came out for 2020. It was a really big deal because when that report came out, it showed that between 2019 and 2020, the prevalence of food insecurity was essentially unchanged. All of us who study food insecurity and was expecting this dramatic increase because of COVID were shocked, but in a good way, because that shows that this robust suite of policies and programs that we had that tackled food insecurity and poverty during COVID actually worked. And so it was a really good thing that food insecurity did not increase to levels that we were expecting, but it also just shows that food insecurity still persists in our country, and it does so because of political forces. So it could be entirely reversible. It could be entirely preventable if we had the right programs and policies in place to address it at all of our levels of the social ecological model. So at the community level, at the state level, and at the national level. I show these maps at the bottom. They are from Feeding America. They're our largest anti-hunger advocacy organization. And I show them because to make the point that food insecurity does not exist in only certain states or certain parts of our state, but it really is a national problem. In every zip code, in every congressional district, there are people who experience food insecurity. And so it should be on the radar of all of our congressmen, of all of our local leaders, and so forth. And in Michigan, the prevalence of food insecurity is 13%. So we are slightly higher than that national average. So what is food insecurity? These are some of the indicators that we use to measure food insecurity. So they are things as mild as you worry that your food is going to run out before you have money to buy more, or not being able to afford to eat a balanced meal. And they increase in severity. So eating less, skipping meals, feeling hungry but didn't eat, all because there wasn't enough money for food. The most severe indicator is not eating for a whole day because there wasn't enough money for food. So if someone endorses 3 or more of these questions, they are categorized as food insecure. Now, food insecurity, even though we analyze it like it's a yes/no question, it actually exists on a continuum. So there are people who just experience some anxiety about their food supply, but they don't actually exhibit any behavioral indicators of food insecurity. They don't change what they eat. They don't change how they eat. They just worry that their food might run out. And that's considered marginal food security. And then as up the continuum, if you reduce the quality of your food, so let's say you eat canned soup or ramen noodles for dinner because you need to stretch your food budget, but you're not actually eating less calories, that would be a more slightly severe indicator of food insecurity. And then once you reduce the quantity of your food, so you're skipping a meal, you're not eating as many calories as you need, that is more very low food security. And for households with children, anytime a children's diet quality or quantity is reduced is characteristic of very low food security. Because as parents, parents try to do whatever they can to protect their children from food insecurity and always make sure that they have enough to eat. And it's only in the most severe circumstances when children's diet is affected. Oops, sorry about that. So who experiences food insecurity? These are characteristics from a national report that is produced every year about the current prevalence and predictors of food insecurity. So these are all demographic subgroups whose prevalence is higher than that national average of about 10, 11%. So households with children, especially households with young children, households with children headed by a single parent, adults who live alone, Black households, Hispanic households, and households with income below 185% of poverty. Across every report, every year, these are the same characteristics. These are the same groups that are disproportionately affected by food insecurity. College students are not part of this group. So they are not separated out into a separate demographic subgroup. So we actually don't know at the national level what the prevalence of food insecurity is among college students. Now, the consequences of food insecurity have been well established. Many of my colleagues and myself, we have published many studies demonstrating the negative impact of food insecurity across the life course. So here are some of the consequences. Again, this is not an exhaustive list, just some of the health outcomes that have been identified. So you can see the consequences really range from affecting parts of our diet to psychological outcomes, other behavioral outcomes like sleep and smoking, overall health status, and especially salient for adolescents, poor academic performance and depression and suicide ideation. So makes us think that food insecurity is not just a food problem, it's not just a nutrition problem. The consequences of it go far beyond food and nutrition. So that brings us to college students. What do we know about food insecurity in college students? And I will tell you that before 2008, this was not even a research question of interest. People were not funding projects about food insecurity among college students. There were no studies being published about food insecurity among college students because The perception was that college students don't experience food insecurity. It is, you're part of the elite few who've been able to get to college, and there are dining plans and there's all these provisions in place, and college is the time for academic learning, professional development. It's not, people don't experience food insecurity. And it wasn't until 2008 that the first study on food insecurity on a college campus was published. And since then, there has been an explosion of studies documenting food insecurity across campuses in the US and abroad. And this has actually made its way into the news media. So there is now New York Times, NPR, there are reports about how college students disproportionately face not just food insecurity, but also homelessness and other basic needs insecurities. And college campuses are really trying to be creative and trying to address this really fundamental problem. There had been two big reports that have been published in the last 5 years that have tried to understand the prevalence of food insecurity on college campuses. So the study on the left, this was a systematic review of published and unpublished studies trying to demonstrate the prevalence and risk factors for food insecurity. And the study on the right was a report from the Wisconsin Hope Lab. And they do annual surveys of food insecurity across 60-some campuses in the US. The report on the right included, I think, Dearborn, but it did not include Ann Arbor. And across both reports, they concluded independently that the prevalence of food insecurity ranged between 35 to 36, 42%. So thinking back to that national average of like 10.5% and the demographic subgroups I showed you, 35 to 42% is astronomically high compared to what we know going on in the general population. In the same report on the right, they looked at who is more likely to experience food insecurity, and what they found were community college students, so two-year college students, former foster youth, gender non-binary students, sexual minority students, Black, Native American, Hispanic, Middle Eastern, and this mixed other category of racial ethnic groups, Pell Grant recipients, first-generation college students, and students who have children themselves were at highest risk for food insecurity. And so we know the general indicators about what happens when someone experiences food insecurity. But what else, in particular, what happens when a college student experiences food insecurity? So this has not been documented, but we know anecdotally that what happens is students miss out on social activities because they don't have enough money to go to dinner with their friends or go to the movies or go to events that cost money. This leads them to feel jealous or resent their peers that have more resources or are more well off. It means that sometimes students scout free food at events on campus or work a lot of hours to make enough money to pay for food and pay for housing. We also know that students hide the fact that they're food insecure from their friends and sometimes even from their family because it's stigmatizing. It's shameful, even though it shouldn't be, that someone experiences food insecurity. Food insecurity has been associated with self-reported GPA. So this is a descriptive analysis of self-reported GPA from letter grades and the proportion of each of those letter grades by food security status. So you can see that for students who experience, for students who have predominantly A's or B's, they are more likely to be high or marginal food security, meaning like they don't really have any problems with food. And then students who have low or very low food security are more likely to have a lower self-reported grade point average. Food insecurity is associated through academic performance, through physical manifestations, as well as a mental trade-off. We know this because a student of mine from UC Berkeley led a series of interviews with UC Berkeley students experiencing food insecurity. And what we found through the data were the physical manifestations meant that students were feeling tired, they lacked energy, so they didn't study. Or they worked a lot of hours and they didn't have enough time to study for their midterms or exams. Sometimes they skipped class because they were ashamed that their stomach would growl and other students around them would hear that they were physically hungry. Or they would just sleep to try to ignore the hunger. And of course, that interfered with their ability to study and do well academically. Those are the physical manifestations. The mental trade-off was thinking about food versus academics. So in class, they were distracted because they were thinking about where they were going to get their next meal or how they were going to budget their food for the week or when they were going to go grocery shopping and not pay attention to the lecture. And so there were kind of two pathways by which we know food insecurity affects students' academic performance. One of the quotes from one of our students in that study, they said, "When you're reading a textbook and you haven't eaten all day, hunger doesn't care. Hunger doesn't care about Napoleon Bonaparte or the built environment. Food insecurity reduces your ability to concentrate. Eventually, it's the voice that's constantly shouting at you. You can't yell at something that is able to yell at you far more than you will ever be able to yell at it." Another student captured their sentiment around food insecurity, and they said, "When one isn't able to afford a meal, it makes you frustrated and angry at the institution and at the society that should be offering healthy food and a sustainable conduit through which food can be provided to people who need it. Anger and frustration are certainly there. Then what comes from that is a sense of regret and sadness. It's a feeling that one is not worth food." So it was promising, after we had been doing all this research, it was promising that in December 2018, the GAO national entity published this report that said better information could help eligible college students access federal food assistance benefits. And they concluded down here that almost 2 million at-risk students who were potentially eligible for SNAP did not report receiving benefits in 2016. Why does this matter? This report is the first national acknowledgement at the federal level that food insecurity among college students is an important issue, which means that we can now write policies to address this. And this report basically said that there, in addition to quantifying 2 million students who were eligible for SNAP and didn't receive benefits, it could not establish the prevalence of food insecurity at the national level because we don't have that data that's nationally represented to do so. My colleagues over at Dearborn wrote this op-ed, and they said in their work over at Dearborn, she said, "One student told us how she encouraged her children to sleep in on weekends so she could feed them 2 meals a day instead of 3. Another referred to shampoo provided by our campus food pantry as gold, since she often couldn't afford to purchase hygiene products. Many more explained, sometimes in tears, how their campus food pantry got them through a personal economic crisis. More work is needed to understand how campus food assistance programs impact student success. The evidence thus far indicates outcomes are positive." So it's wonderful that many campuses, including our own, we have a Maison Blue cupboard. We have acknowledgement of food insecurity on our campuses, but we shouldn't think that because we have Maison Blue cupboard, because we have a food pantry, that this is somehow magically solving our problem of food insecurity. More work needs to be done to evaluate the impact of the cupboard on students' outcomes, as well as understand what else the university can be doing to alleviate food insecurity. So what's happening at Michigan? When I came to Michigan, one of the first things I did was I administered a survey because I wanted to understand what was the prevalence of food insecurity among our own students. So we conducted this in 2018. We had a response of 851 students, 43% response rate, and we waited to make estimates that were reflective of the enrolled student population at the time. Now, these are those indicators of food insecurity from the USD scale that we used. And you can see that for the first 3 indicators, about 30 to 50% of students said, yes, They worried that their food would run out, their food didn't last, and they couldn't afford to buy more, and they couldn't afford to eat a balanced meal. That was by far the most prevalent indicator. The more severe outcome or indicators, the response tapered off. That's to be expected. But still, about 10% of students said that they lost weight because there wasn't enough money for food. They didn't eat for a whole day because there wasn't enough money for food. Combined, 50% of our students in the sample were high, completely full food secure. 17% had marginal food security, so they were worrying about their food supply, but nothing more severe. And about 30 to 33% of students were food insecure. So 33% is right in that same range that we saw that was happening from the systematic review and the Still Hungry and Homeless in College report, showing that U of M is actually not that different from other four-year colleges in the country. Food insecurity impacted dietary intake. Now, I am in the Department of Nutritional Sciences. I care a lot about nutrition because I know that those habits are established in young adulthood and they lead to chronic disease outcomes later in life. Very low food secure students on our campus were more likely to eat fewer servings of whole grains, fruits, lower intake of dietary fiber, and higher intake of added sugar, especially from sugary beverages, compared to fully food secure students. In that same survey, we had students self-report their height and weight. We calculated BMI. I know BMI is a flawed measure for many reasons, but for population level estimates, and in terms of showing health disparities, it is still fine as an outcome to examine, but I would not use it at the individual level. But what I'm showing you in this slide is that there seems to be this gradient where students who have high or full food security have the lowest average BMI, and students who have very low food security, the most food insecure group, have the highest average BMI. And for those of you who understand what BMI means, a mean of 26 is not a cause for concern by any means. But what I'm looking at is this disparity between the very low and the high groups. So this difference of about 2.5, 2.6 units, because we're already seeing that in young adulthood, in college students, when people are supposed to be very healthy and free from chronic disease. What is going to happen to this disparity when students leave college, when they enter adulthood? We're going to see these disparities magnify. And so it was concerning to me that this was starting and observable even in our sample. And then finally, food insecurity impacts GPA. This was not self-reported. This we pulled from the registrar's office with consent from students in our sample. And the mean GPA for students with high or full food security was 3.5. And you see this gradient, this dose response. The more severe a student was food insecure, the lower their GPA. So the mean for the very low food insecure group was 3.2. And this difference of 0.3 GPA units between the high and the very low is exactly what we saw in the University of California campuses. So again, showing that this is a consistent association that is not limited to just the campus. Now, food insecurity is also tied to other basic needs. And in the same survey, we asked about housing insecurity and financial insecurity. And this is just showing the intersection of all of these. And so about 10% of students experience all three: food insecurity, financial insecurity, and housing insecurity. And in a study that I'm not showing you here, the more basic needs insecurities a student faced, the lower their self-reported health status, the lower their GPA, and the higher their prevalence of anxiety and depression. So showing that it impacts physical health, mental health, as well as academic performance. So when we think about addressing food insecurity, understanding that it doesn't exist in isolation, and students who experience food insecurity may also experience other basic needs that need to be addressed. We also did some interviews with students, because interviews and getting to talk with a student one-on-one is really important to understand their lived experience. So from that survey that we administered, we invited students to talk with us in a private setting about their personal experience. And we were allowed to record their interview. And then we analyzed all of the interviews we led to try to see if there are some themes that are recurring across. And so there were several themes, but on top of that, we also embedded a photo voice study. Photo voice is a type of community-based participatory research where students can send in photos around a theme. In this case, it was around their experience of food insecurity. And the photos then become our data. So the photos are taken with a purpose to illustrate something about their experience that the student wants to show. The photos, we then interview them about the photos they took and what they want the photo to demonstrate. So I'm going to show you a couple photos and then summarize the themes from the interviews that we led. So this was one of the photos that a student submitted to us. It's actually, it's Main Street. It's one of my favorite parts of Main Street because I love seeing the lights in the winter time. But the student said, my original plan was to walk around to take my mind off of food and then go to bed. I told my friends I had steps for dinner. When I was walking around, it took my mind off of food. I didn't really realize I was hungry, but when I got back to the dorm, I was so starving. I got chips out of the vending machine and then went to bed. So it kind of shows that students who experience food insecurity try to distract themselves from hunger. They walk, they sleep, they engage in a variety of coping mechanisms. And then at some point, the hunger catches up with them and they just eat whatever they have available. And then sometimes they feel guilty for not being able to manage their physiological hunger sensation better. Here's another photo that students sent in. Looks like their Spanish book. And they said, that's my Spanish class from 1 to 2. Most of the time I haven't eaten. I had a hard time paying attention. It definitely is something that makes it harder for me to learn, which is the point of what I'm supposed to be doing. I just feel like it's one thing that kind of stands in the way that other people don't have to worry about. So this photo and the surrounding quote really just shows that food insecurity is an academic interference, and it's a distraction from why they're here at Michigan in the first place. And it's something that separates them from other students, at least in their minds. This was another, the last photo I'll show you. It looks like someone's dorm room late at night. And the student said, this is reminiscent of those nights that you go to sleep and you're hungry. You lay there and it's empty, it's dark, and you're just there. If you're hungry, it's hard to sleep, but you're also thinking about where you're going to eat next, and almost the idea of not knowing and just looking out into the darkness. So to me, this illustrates loneliness, difficulty sleeping, depression, and just this uncertainty of where your next meal is going to come from, which is one of the stepping stones to more severe mental health disorders. So how else does food insecurity affect student well-being? Well, we heard a lot from the photos, but in addition, we did those interviews. And from the interviews, we heard that there was anxiety about the next meal, leading to sadness and depression. There was lying to friends or putting themselves in awkward social situations. One of the students talked about how in order to get to celebrate her roommate's achievements with her at a restaurant, she would drink her water really quickly and then lie and say that she had a stomach ache, and that's why she wasn't ordering food. And she felt that if she kept doing that, then others would catch on and know that she was lying about what was actually happening. So there was that fear, but also feeling like you had to, that it was necessary to lie to your peers in order to feel involved in other situations. They were stealing food from roommates. One of the participants talked about how he felt guilty because he would eat his roommate's food when they weren't around, but in the end, he at least felt glad that he wasn't hungry. And then there was feelings of loneliness and shame stemming from one's food situation. So we asked students if there was anything that they wanted to tell their peers who might be experiencing similar situations as them. And one student said, I can't put it into words, but there's a stigma. It would be helpful to destigmatize hunger. Completely agree. And another student said, I love you, you're not alone. So that leads me to my last section is, how do we alleviate food insecurity here? Well, I think I'll start with the most obvious solution, which is our fabulous Maison Blue cupboard. When I started here at the university, this was a student-led organization with monthly rotating food distributions, and now it is this beautiful permanent space that's open almost every day and serves so many more students. So I'm super proud of all the folks who work so hard to make sure that students on our campus can have enough food. And I'm sure everyone here knows about Maison Blue cupboards, so I'm going to skip through most of these slides. But just kind of shows you this long history that it's taken to implement this permanent space. I'm actually going to skip through. I think most of you know all of the services that Maison Blue Cupboard provides. It's not just food, like my colleagues at Dearborn who had interviewed students and were saying like soap is, or shampoo is gold. I'm so happy that there is a separate space at Maison Blue Cupboard for personal hygiene products and cooking supplies, because all of this is intersects with food insecurity. And one day, I think the goal is to have other experts on campus to provide financial assistance, SNAP application assistance, and more. And hearing from other students on campus about what other services are needed is certainly important. I will just skip through some of these slides. These numbers obviously need to be updated. And I'll just end with this slide, which is the Still Hungry and Homeless report had ways that we should be addressing food insecurity. Obviously, campus food pantries are a very important resource, and we're very happy that there is one that exists and has been successful for so long. But again, it's not the only solution to food insecurity. On top of that, there are food recovery programs, dining center meal donations, campus community gardens, campus farmers markets, basic needs case management, which for us happens to the Dean of Students office, emergency grants, and more. And so hopefully, in a couple years, when I show this slide again, we will have the last few boxes or even a longer list provided, because obviously we need multiple strategies across all angles coming to address food insecurity. And so I will end with that and open it up for questions.
Thank you, Dr. Leung. I'll keep an eye on the chat and relay any questions. What was the name of the photo service again, is the question that we're getting right now.
Do you mean the photo study that I showed?
I think that's what they're referring to.
Okay, so that is a method and it's called photo voice. And it is a method of community-based participatory research. So it's not only used for food insecurity, but it's used as a way to give participants a voice and a way to show their lived experience that is not just through an interview or through a survey.
Thank you. Another question is that I'll go ahead and answer. You all will have access to the recording of this presentation. And then we have another question that says, I'm not familiar with the cupboard. Could you maybe show those slides just for a brief moment, please?
I'm sorry about that. I was mistaken in my assumption that all of you were familiar with the Maison Blue cupboard because of the way the series was structured. I truly apologize. So let me pull that up. Okay. Let me share my screen again. Okay, I'm not going to do presentation mode. I'm just going to show my slides here. It is Maize Blue Cupboard is in the basement of the Betsy Barber Residence Hall. You can access it on Maynard Street. And perhaps other folks here who represent the cupboard can speak a little bit more about the process for accessing food.
Do you want me to touch on this?
Sure.
Okay. So right now our process is a little bit different because of COVID. It's still the same process as this, just showing your response of blue, washing your hands prior to grabbing a baggie or a basket, and wearing gloves throughout the store just to eliminate the touching and overlapping of germs.
Great. So yeah, you do want to bring your M card. It is like going to a grocery store. I have always been amazed at the selection of fresh produce and meats and shelf-stable items that is on hand. And I tell my folks over at SPH or my own students in my classes to just go and check it out, bring a friend, because you never know who might be experiencing food insecurity. And the more that we can raise awareness that this resource exists, the more we can elevate its presence and make it known that this many students have used it, which is a signal to our administration that this many students need to get food. Any other questions?
Let's look. So we have from Keith, thank you, Dr. Leung. Your work supports the cupboard and hopefully helps to reduce the stigma associated with food insecurity. I can definitely agree with that one. I appreciate the focus to this community of students. I'm about to start working in Detroit as part of my social work program and already see many overlaps even with the differences in population served. Are there any references you can suggest to aid food insecurity solutions for that community specifically? So Detroit.
I would suggest starting with the Detroit Food Policy Council, as well as the local food banks. And so I think Gleaners is the big one that serves Southeast Michigan. They will definitely have local statistics around food insecurity. If you go to the Map the Meal Gap link at Feeding America that I showed, you can narrow it down to, I think, by food bank, the prevalence of food insecurity among the people served, and by county. So those are great starting places, but there is a really robust group of folks who are working on food security issues in the Detroit and surrounding neighborhoods. And so that would be a good place to start.
Awesome. It looks like that person says thank you. We have an additional comment that says, I went to UCLA for undergrad and they had a campus resource where staff would help you fill out a SNAP application, provide service to and from the DPSS office that provides SNAP benefits, etc. I know you all said you're working on getting that type of service implemented, and it will help immensely coming from a former SNAP beneficiary.
Thank you for sharing that. That is, I agree, is such an important resource that I hope we will one day be able to provide. And I know that we have been having conversations with food gatherers, our local food bank, who might be able to help provide that service in the future. For anyone who has applied for SNAP, it is a beast of an application. There are so many documents you have to provide. It is and can be a very burdensome and unwelcoming process. And the more that we can engage our community resources to help students specifically, the more we can get students on the program that they're entitled to benefits for.
Yes, agreed. I know we are still working on getting the Maize Blue Cupboard, providing SNAP assistance, and we are available for that. And also the Office of Dean of Students as well is working on that or can assist with that. Does anyone have any more questions? If so, please drop them in the chat. Alrighty, I'm not seeing any more questions, so I wanted to thank Dr. Leung today for being here with us and having a wonderful presentation. Thank you for kicking off the learning series for us. Really much appreciated. I wanted to thank all of our attendees as well. It looks like Dr. Leung added her email into the chat, which is awesome. Thank you all for attending. Our next event will be held on October 20th. And this event is going to be in person at the cupboard, so space is really limited, and you'll sign up at the same sessions link as this one. And we'll be joined by Dining nutritionist Eliza Jarman and Chef Frank. Like I said, space is limited, so sign up early, and thank you all for attending.
Thank you everyone for spending your Wednesday evening with us.
Yes, someone is explaining or asking me to explain what the next session will be on. So we will have a nutritionist from Dining, as well as a chef who is going to do a demo here in the cupboard, which we're very excited about. The capacity limit is 12. So go ahead and sign up if you're interested in that. And like I said, the presenter will have a short presentation on nutrition and then have a cooking demo. Of course. Thank you all and have a great night.